Hi, everyone. Welcome to week 7 of your Medical Language 2 course. This week we are covering chapter 16, and the title of this chapter is probably your tongue twister of the course. It is otolaryngology. So what this means is we are studying the structures of the ear, nose, and throat system. So ENT is what it's commonly known as. So we're going to be looking at the process of hearing, along with all of the different types of diseases and laboratory diagnostic and medical surgical procedures and medications that affect the ear, nose, and throat. And then, of course, we're going to look at word forms like we have in the past chapters as well. So this particular tongue twister is the medical specialty that studies everything about the ear, nose, and throat and the mouth, because obviously that is connected to this system. So that is why they include that. So basically, this entire system is in the head and the neck. We have both internal and external structures. So you're going to be looking at that as well as how those structures are shared with other systems. So obviously, the mouth is shared with the gastrointestinal and the respiratory systems. So you're going to be looking at how those are all related and how they are used for all of those functions. And then you're going to look specifically at the ear. So we have both external ear, which is all of those things that obviously you can see from the outside, right? Everything from the earlobe to the opening into the internal part of the ear. And so when we look at the internal part of the ear, and I'm just trying to get to that real quick. There we go. You're going to see we have a lot of pieces that are part of the internal ear, and we split that internal ear into parts as well. So both the middle ear and the inner ear. Then we're going to talk about how some of these small bones work together to allow us to hear. So how do those things happen? And then how is all of that related to your nasal cavities, to your mouth, those types of things. So all of this is connected. So what we want to really understand is how does it all work together, right? And how does one affect the other? So those are the things that you're going to look at as you go through and study the anatomy of this particular system. And of course, they are going to talk to you about how does hearing occur? What's the actual process for hearing? So this is just an example of the process, what happens in order for you to be able to hear. And then, of course, we're going to look at the diseases. So it can be everything from here is a good one, the serum impaction. That's just earwax, right? So what if we have earwax in our ear? You know, obviously we can't hear. If you've ever known anyone who had an impaction, you know that can also be quite painful as well. We're going to look at the tinnitus, ringing in the ear. We're going to look at ear infections, vertigo, which is dizziness that has to do with those small little bones in your ear, believe it or not. So all of those things are things that we're going to be looking at as it applies to the ear. And then we're also going to look at the diseases that go along with the mouth. So everything from a cold sore to mouth cancer, etc. And then finally, we're going to look at some of the tests that we can have done, whether it's a hearing test to test whether or not a patient has hearing or has hearing loss is more likely, right? To the things that we use for the other parts of the system, like a strep test to make sure that, we can confirm whether we do or do not have a strep infection if we've got a sore throat. Those are all different types of diagnostic procedures that can be done. Then we'll look at the medical and surgical procedures. So maybe we're looking at having your tonsils removed or having polyps removed, having a nose job done. That's rhinoplasty, so that's reshaping by surgery. Those are all included. And then finally, we'll look at the drugs. So the different types of drugs, everything from antibiotics to antihistamines to antitussives, all of those things are used treat some of those diseases that we mentioned. So if you have any problems or questions this week with this material, please make sure that you reach out to me, and have a great week.